Let's talk about high blood pressure. It's one of the most common health problems on the planet. But what happens when the usual stuff, the standard treatments, just don't work? Today we're diving into something called resistant hypertension. And let me tell you, there's a whole new chapter opening up in the fight against it.
To really get a sense of how big this is, just look at this number, 90%. For most adults, that's the lifetime risk of developing high blood pressure. It's pretty much a guarantee that it'll affect almost all of us, or someone we love, at some point.
But here's where it gets really tricky. For a pretty big slice of that group, we're talking 10 to 20% of patients, their blood pressure stays dangerously high no matter what, even when they're taking multiple medications. And that's what we call resistant hypertension. It is a massive medical challenge. So, let's properly introduce this thing. It's a tough adversary in the world of heart health. Why is it so incredibly hard to control, and what is it that makes it such a huge risk for things like heart attack, stroke, and kidney failure? In the clinic, the definition is super specific. We're not talking about numbers that are just a little bit high. This is when your blood pressure stubbornly stays above 130/80, even while you're on a powerful cocktail of 3 different optimally dosed meds, one of which has to be a diuretic. It's a high bar. And this is not some rare, obscure problem. We're talking about as many as 1 in 5 people who are already being treated for high blood pressure. That's millions of people living with this uncontrolled pressure, which puts them at a way, way higher risk for serious complications.
So why that word, resistant? It makes it sound like the body is just stubbornly fighting back against the medicine, right? Well, as we're about to see, the real story is a lot more complicated than that. This is literally the first question a doctor has to figure out. Is the medication actually failing to do its job, or are there other things getting in the way that just make it look like the treatment isn't working?
So you've got to separate things into 2 buckets. First, there's pseudo-resistance. That's not a failure of the drugs. It's caused by stuff like a BP cuff that's the wrong size, or just being super anxious at the doctor's office, the classic white coat effect, or honestly, patients just not taking their pills correctly. Then you have true resistance, which is when the body's own systems are genuinely overpowering the medications.
And for that true resistance, doctors basically become detectives. They go down a checklist of culprits. It could be lifestyle stuff, like eating way too much salt. It could be other common meds, like ibuprofen, or even some decongestants that are messing with the treatment. Or it could be a totally hidden medical issue, like sleep apnea or hormone problem.
And check out this quote from Dr. Keith Ferdinand because it adds another really important piece to the puzzle. Sometimes, the problem isn't the patient or the drug at all. It's something called therapeutic inertia. And that's just a fancy way of saying that doctors sometimes aren't aggressive enough about upping the doses or changing the meds to really hit that target blood pressure.
Okay, so if this problem is so complex, how are we fighting back? Well, the first part of the answer lies in a brand new, modernized clinical playbook that gives doctors a much, much clearer strategy.
These new 2025 guidelines, they're a huge deal. They basically sweep away all the old confusion and set one clear, simple, universal goal for almost every adult out there. Get that blood pressure under 130/80, period. And this lays out the new game plan perfectly. It's like a ladder. Step 1, you max out that standard 3-drug combo. If that doesn't work, step 2, you get aggressive about screening for those hidden secondary causes. And if you're still not there, step 3, you add a 4th-line drug, which is usually spironolactone, a med that targets a very specific hormone pathway.
But look, an updated playbook is only half the battle. The other half of the solution is a whole wave of brand new drugs, the first in a generation, really, that are designed specifically for these really tough cases.
And just to give you a sense of why this is so exciting, look at this. There was basically a 40-year gap, a drug development drought, with no major new classes of blood pressure medication. 40 years. That all changed in 2024. And here are the new players. First up, aprocitentan, which is already FDA approved. It works by blocking a pathway that squeezes blood vessels shut. Then you've got this new class called aldosterone synthase inhibitors. They go after a hormone that makes you hang on to salt and water. And then there's this really futuristic therapy, zilebesiran, that uses RNA to basically switch off the gene that makes a key protein that raises blood pressure. Wild, right? This take from Dr. Florian Rader really shows why these new drugs matter so much. They're not just another version of the same old thing. They give new options to very specific groups, like patients who have kidney disease and just can't handle the side effects of the older medications.
Okay, so we've got a smarter playbook and we've got brand new drugs. But the last piece of this revolution, it's something totally different. It's a tech innovation that offers a completely new way to think about treating hypertension.
This question really gets to the core of it. I mean, for patients who have a hard time remembering multiple pills every day, or who just plain don't want to be on them, what if there was another way?
Well, here it is. It's called renal denervation. It sounds like science fiction, but it's a real, minimally invasive procedure. A doctor uses a catheter to deliver a bit of energy, like radio waves or ultrasound, to calm down overactive nerves that wrap around the arteries going to your kidneys. See, when these nerves are firing too much, they tell the body to jack up blood pressure, so quieting them down can have a really powerful, lasting effect.
So what's the bottom line on this procedure? Well, first off, it's here now. 2 different systems got the FDA's green light in 2023. It's a fantastic option for people who want to avoid or reduce their daily pills. Now, it's important to know it's not a magic cure for everyone. The results can vary. That's why it's a decision that really needs a deep conversation between the doctor and the patient. And the great news is, it's now covered by Medicare, which makes it an option for a lot more people.
And I love this quote from Dr. Anna Krawish because it just perfectly captures the human side of this technology. It gives us a real, science-backed alternative that respects what the patient wants, especially for those who really prefer to be off medications.
So, let's just pull this all together. The big story here, the main takeaway, is that after decades of being kind of stuck, this entire field is just buzzing with new energy. We have a smarter playbook, a new generation of drugs, and these incredible new device-based tools.
And all this leaves us with one final, really powerful question. With this new, 3-pronged attack, combining smarter strategies, better pharmacology, and new technology, are we finally about to turn the tide against one of medicine's most stubborn and dangerous enemies? Honestly, the future looks brighter than it has in a very, very long time.